Hi everybody, it's Kate from Valere, and today I'm going to take you through 4 of my most helpful tips when it comes to managing medial tibial stress syndrome, or more commonly known as shin splints, and that is what I'm going to call it for the rest of this video. Now, if you are not sure whether you have shin splints or something else, make sure you check out this video and that will help give you some tips whether you have shin splints or, there are lots of other things that it may be. So it is important to get that correct diagnosis before you start managing it in a particular way. Now, the exact cause of shin splints is still a little bit unknown in the literature, so we're not 100% sure of the pathophysiology. Some research suggests that it may be fasciopathy that causes the symptoms and the pain, and some other research suggests that it may be from bony overuse and some bony injuries. So we don't exactly know, but what we do know is that there are some best practices that we can do to help minimize those symptoms to get you back to pain-free running as soon as you can. Often shin splints are from an increase in training load, whether that be doing too much too quickly in terms of volume or intensity. Research does show that as little as a 10 to 30% decrease in your training load can be enough to help minimize those symptoms and get you back to pain-free running. You can reduce this, like I said, either in terms of the intensity of your sessions or the overall volume of the sessions, and this is going to be very dependent on you and what you have done to increase your training load. So have a little play around there. You can start with a 10% decrease, and if you do need to have more of a decrease in your load, then you can have a little play around and see what works for you. It is important to consider that with decreasing your training load, your runs don't necessarily have to be completely pain-free. If you have a stress fracture or stress reaction, then you do not want to run and they should be pain-free. But in the case of shin splints, there is actually research to support that running with pain levels of approximately a 2 out of 10 can actually help improve your recovery from shin splints than running only when it's pain-free. And this is important to consider because when you do have an injury, you don't want to completely unload the body from running. And then when you are able to go back to running because you're pain-free, have a sudden increase because you might end up with a different injury. So it is really important to consider that you don't have to go completely pain-free. I know that everybody has a different version of what a 2 or a 3 out of 10 is for them, but for yourself, when you are considering changing your training load, generally keep those guidelines of a 2 to a 3 out of 10 as your maximum that you do want to push through for those runs, but it is okay to run with a little bit of discomfort and pain when you do have shin splints. My next tip is to be realistic about your timeframes for recovery. Now, keep in mind that you can run through that little bit of discomfort and pain, but it can actually take up to 9 to 12 months for you to completely recover from your shin splints. I'm not saying that everybody is going to be in that case. Some people, when managed appropriately and if they catch it early on, can recover much quicker than that, but it can take up to that long. So do keep that in mind, because if you don't, you can get really frustrated with the process and wonder why it is taking so long to recover and think that you're doing something wrong when you're in fact not. So do have realistic expectations in mind when it comes to returning to pain-free running. My next tip is to have a look at your running cadence. Research has shown that in individuals with a low cadence, so this was 165 or lower, were more susceptible to getting a form of shin pain than those who had a higher cadence. So that was 174 steps per minute or higher. This is proposed to be because when you have a lower cadence, there is more overstriding and therefore more impact and more load going through the tibia, which makes you more susceptible to getting something like shin splints. So if you do fall in that lower cadence category of 165 steps or less, or even if you're around 170, it may be worth playing around with a metronome and increasing your cadence even just a little bit, even 5 to 10% in small chunks at a time, and increasing your cadence because that can actually decrease the load through your tibia and help minimize those symptoms, particularly through your tibia. The last, but certainly not the least important, is to include a form of strengthening in your program to help build up your resilience and your robustness with that return to running. Research does show that strengthening programs that include a form of ankle dorsiflexion, so that's working on your tibialis anterior, so the muscle at the front of your shin, can be really effective in helping minimizing shin splint symptoms, but also working on your ankle plantar flexors. So that's your gastroc, but more importantly, your soleus. So it's really important for your rehab program to include ankle plantar flexion and dorsiflexion exercises, but you also want to consider the rest of your lower limbs. If you're looking at doing things such as improving your cadence or changing your running biomechanics, which may help, you want to make sure that you have enough strength in the rest of your lower limbs limbs to be able to handle these changes. So I'm going to take you through 3 really simple exercises that you can include to help minimize your symptoms of your shin splints and to help minimize your risk of getting them again. The first exercise that I'm going to take you through is one that is going to work on that tibialis anterior, or the muscle at the front of your shin through here. With this one, particularly for runners, I always like to include that ankle dorsiflexion movement in something that's a little bit more functional and that will strengthen up everything that will help you with your return to running. So with this, you're going to pop the band around your feet through here, holding onto something just for some support. And with this one, I want you to really think about keeping your toes of the leg that we're going to come into a hip flexion pointing up towards the ceiling. That will make you isometrically load up through those ankle dorsiflexors the whole time throughout this movement. So from here, pointing your toe up, powerful hip flexion, hold for 1 second at the top, come down, tap, powerful, up strong, control, down, tap, up strong. I love this one because you isometrically load through those ankle dorsiflexors, which is really important, but you also get some really nice hip flexion work as well, and you get to work on the stabilizing glutes of the standing leg, which replicates what you do in running. So it's a really nice all-round one. With these ones, I would start with 3 sets of 8 repetitions on each leg, and I would do that 4 times a week. Next exercise that's great to include is the one that is going to work on those ankle plantar flexors. So they are your calf muscles, and in particular, as I was talking about, we really want to work on that soleus, so the deeper of the calf muscles. So when we want to bias the soleus, you want to keep an eye on making sure that your knee is bent throughout this movement. Because the gastroc crosses over the back of the knee joint, when we bend the knee, we sort of, for lack of better terms, deactivate that a little bit more and we bias our soleus. So that's a really important tip when it comes to including any of your calf strengthening for looking after shin splints. So with this one, a really nice one to start with is just some body weight bent knee calf raises. Of course, to progress, you can hold onto some weights, okay? But to start, body weight is a great place. So with these ones, we are going to go single leg because when we run, it's single leg, so we really want to make sure that we work on that. I'll do this leg just so you can see better. From here, knee slightly bent, forefoot comes on a step or on some weight plates, as you can see as I have here. Anything works. If you're doing them at home, see what you can stand on. Knee bent, we're going to start with the ankle all the way down, powerful, up, driving through the first and the big toe, control, slowly down, okay? Powerful up, slowly control, down again. With these ones, it will depend, particularly on your soleus strength, how many you can do. But if you can start with 3 sets of 12 repetitions on each side, 4 times a week, that's a really good starting point. This last one that I'm going to take you through is a stiff-legged deadlift. And the reason I've included this is because we want to work on everything in our lower limbs. Like I was saying, whilst there's weakness through the ankle plantar flexors and the dorsiflexors, we still want to work on the rest of our lower limb muscles to make sure that we can improve our running biomechanics. In particular, if you're working on improving your cadence to help minimize the load through the tibia, you do need to make sure that you have appropriate strength through the hamstrings to stop that lower leg part of you from overstriding. So this one in particular, I've chosen to strengthen up through the hamstrings. So with these, I do these with dumbbells. If you want to load them up even more, you can of course grab a barbell. It's completely up to you in the level of strength that you are at. But with these, hold those dumbbells really nice and close to the body. Slight little hip hinge or a little bend in the hip, slight little bend in the knees as well. But from here, because it's stiff-legged, we're not going to bend the knees anymore. So it's all about creating that nice hip hinge, controlling down, keep those dumbbells nice and close to the body, control down to a range that works for you until you feel that tension through the hamstrings, up, nice and strong. Control down again, nice and slow control, feel the tension through the hamstrings, up, nice and strong. And repeat. Keep those dumbbells nice and close to the body the whole time, up, nice and strong. With those ones, I would start with 3 sets of 8 repetitions at a weight that only leaves you with approximately 3 reps in reserve. We really want to build up through that hamstring and glute strength as well. This strengthening component, whilst I left it to be the last point, it doesn't mean that it's the least important. Research does show that in individuals with shin splints, they have a 50% decrease in muscular endurance through their calf muscles and a 20% decrease in strength through their tibialis anterior, so the ankle dorsiflexors. Whilst people may argue a little bit in this research, maybe they have that weakness because they have shin splints, maybe it wasn't the cause, and that is a valid argument. We don't know for sure, but we do know that it does exist, and we do know that strengthening those can help minimize the load through the tibia. So make sure that you do find the time to include that in your program. Also, if you're looking at altering your training load, keep in mind that when you drop that 10 to 30% back, you can always substitute this with other forms of exercise. So if you really do miss that running, you can replace it with a form of water running or cycling or any of these strength exercises to make sure it fills your cup of being able to make sure that you can work out as much as you want to. So if you have shin splints, I hope that these tips have been really helpful for you to get back to your pain-free running. Keep in mind that this does not substitute medical advice, and as you need to, always seek appropriate medical care. If you have any questions about shin splints and how you should manage them, or any particular questions about your training load, you can pop them in the comments below.